Hi, I'm Babu Ahmed. I'm sharing my views. Now, in terms of emergencies, in terms of crisis like the COVID-19 situation that we have, it's the speed with which we act, that serves the purpose. If there is any delay, there may be thousands who lose their life, or there may be many who will be losing their livelihood. Now, how to approach all of them in a scalable manner in the quickest possible time is a challenge. Now, this is where technology comes in. I believe that a good combination of data and in the hands of the government, machinery can make things really change. The experiences that we had during the COVID crisis and the latest crisis that we are facing, this Ukraine crisis, we use these technologies, in a very highly scalable and a fast manner. Now, in terms of data, if I speak about data, I would say that data is the most powerful weapon, and you all know that data. The guys who owns maximum data are financially and resourcefully also most powerful if you look at the world scenario. So I believe that a government who has maximum data, which they use it for helping their citizens, they can be the most proactive government. I believe this because we have the data of our households. So you take Andhra Pradesh, we have around 1.5 crore, that is 15 million households. Where there are around 5 crore population. Now we have the information of these people, where they are, their occupation, their contact numbers, communication details, and the kind of schemes that they're getting. Now, when a crisis comes in, say suppose, the COVID kind of a situation comes in, it is a new crisis that everyone faced. Perhaps maybe 100 years ago, there was a similar kind of a pandemic, but now we are facing after 100 years. Now everyone had questions, you had all the issues related to tracking, tracing, contact tracing. You take anything that was an SOP in a COVID-19 prevention and treatment protocol. We could use this data in all that scenario. Now, we had people calling in. We immediately started a COVID control room at 104. A person calls in with his mobile number, we know all his details. We create a database of what he's suffering from. Who are was he tested or not? That the testing statistics come in. Even the testing tool was given to the testing team using this database, interlinking with the IoTs that they are having. We gave some simple, mobile applications by which they do the testing. We also had a system wherein people went from house to house, did fever survey, with the IR temperature gun and the, pulse oximeter. That data came in through the IoT devices. So we knew who is suffering from, fever and COVID kind of situation, conditions. So even before, when the testing infrastructure was not ramped up, we had a situation where all the people who had a feverish and similar symptoms which are related to COVID, we could ask them to isolate. We could contact them on a regular basis. We used this even for crowdsourcing, in terms of the information that is coming from the people, and also we used it for teleconsultation. Now we are a situation where there was a requirement of thousands of doctors, and then we had patients, all along. So how to link them? So we in fact brought in around 6,000 doctors, specialists and general doctors, all into a common pool, and we connected these calls directly to the doctors. And when the doctor speaks to a patient, entire scenario changes. The doctor works with an app, and he gives a prescription, and then the prescription goes to the ANM's IoT, and the A&M goes and gives the medicine and give other kits and other things. So it's like a complete, encircling of all the issues related to, the SOPs of COVID. Now, but for technology, let me be very frank in telling that we would have touched base few people, but not all. And it was one of the primary reasons by which we could face this crisis with such a large number of population getting up. Now, scaling up a little bit more into this, we had crises like cyclone and others earlier, where we had, more data in terms of camera, in terms of weather data coming in terms of communication, like for example, a cyclone triggers somewhere in the ocean and it takes around 10 days. So we follow the course exactly where it will come and attack. So we first give the information to the fishermen who are going to go with their communication details. A prevention is done there. Then we map out the exact, geo coordinates in which this IE and others will move. So we could immediately, alert the people because we have the geo coordinates of every household. And we talk to them, telling them, what precautions they have to take. We also have the data of all the vehicles in that area. So we call all the vehicle owners, asking them not to venture out during that. And it's a combination of all these things that will, work. Now, the latest in this regard is related to the Ukraine crisis. No, we didn't have a database of how many students are there in Ukraine or how many people who have gone as professionals or business for business in Ukraine. But when we quickly came up in 3 hours time. We quickly came up with an international dial-in number and a WhatsApp group, and then a toll-free number of 1902. Where the parents and relatives could call. And let me proudly tell that in a matter of 3 to 4 hours time, we could collect the data of around 760 students, who actually are from Andhra and who are there in, Ukraine. So we quickly formed a WhatsApp group because most of them are international numbers. And we started, triggering the alerts which are coming from the Ministry of External Affairs, the embassy. We also touch-based all the households. That means we could send people and with the information that we have to every household where these students belong to, giving them some kind of a strength. And then tracing their movement right from Ukraine into the 5 border countries, then looking at how the flight movements are happening, when they are landing, and booking them online. All these were planned through a workflow and a call center kind of a mechanism. So the future is belongs to the future. Good governance states will be those states which use IoT and data for all its governance purposes. So the perspective of what I am trying to tell here is that if anyone is missing that, what we are missing is not just some realm of governance, but what we are missing will be an opportunity of good life for our citizens. So how I look at these next gen technologies, in terms of how we can clearly have a visibility in terms of the people as per the situation that exists. Now, the emergencies may come up, the crisis may come up. It may affect a section of people, it may not affect another section of people. But we should have tools and data to really pinpoint those things. So in this, artificial intelligence, machine learning, all that comes in. Now, when it comes to government services, it also helps in plugging all the leakages. It helps in ensuring that the real live people are getting the benefits. We are seeing that in all our welfare programs and distribution programs, including DBT, and where there is an authenticated uptake of, goods like public distribution system or other welfare, distributions that happen. But for technology, the scalability cannot be achieved. But for technology, the inclusivity cannot be achieved. We should. It's a tool. Technology acts as an important tool for inclusion. Now, I just tell you a small story in this regard. When we introduced the authenticated uptake of PDS and the other authenticated, pension distribution, I was a district collector in one of the remotest district in India. It's called as Adilabad, 60% tribal village. So once I was in a public distribution center, a person came for taking, he was a tribal person. He was having a single piece of cloth. He came and he showed his hand. And I found that Aadhaar number tattooed there. Now, when I saw that, tears came to my eyes, to be very frank. And I asked him, my dear friend, why you are doing this? No, because this is a number which will be lifelong on your body. So he gave me an answer, which I believe that the most learned professors even cannot do it, cannot give. I mean, of course, that's the experience he spoke. He said that I'm not educated, so I cannot remember a 12-digit number. He says that I do not have a pocket where I can keep that Aadhaar, letter. He also says that, when I got this number, I came to be recognized as a live person. I got my first ration in my life. I got my first pension in my life. Now this is my everything. So I put my number here. I mean, for me, it was a shock of my lifetime. There are people like that. We could recognize that that person was alive because of the number that we saturated across the country. So it was a tool of inclusion that was brought in. And at the same time, with the same tool, we ensured that the distribution that was happening to the so-called people who were in the grave, that means the dead people, or the fictitious characters like Sherlock Holmes, whose just names were there, but the people were never born. All this could be avoided, and that the same resources we could divert to the people who are really alive. That's how such people gets their, benefits. Now, when it comes to technology types, that is a common sensical question. Everyone knows what kind of technology is there. Every day things are changing. But I believe that a proper mix of IoT devices, when I call IoT devices, it includes a small smartphone. It includes a sensor kept in an irrigation canal. It includes a camera, a CCTV camera. We have 18,000 of them, including the ANPRs, and the PTZ cameras, which are there in the roads and streets in Andhra Pradesh. It also includes these, the authentication devices. It includes the micro ATMs, which are there with the banking correspondent. A pool of, millions of IoT devices with the smallest functionary to the largest functionary. When I call the highest functionary, not largest, highest functionary. The highest functionary here is our, we have the policymakers and the government asset. So even in government, even the ministers and the chief minister, they use the digital signatures. You look at e-office system. When that is a level of technology adoption, we can see that the things move faster, and the decisions come much quicker. So I would say that the government organizations should focus on skilling their people. Like we have a cross section of people. We can bring in any kind of technology, but unless and until the last person adopts it and use it, the technology can only be named as a technology, or it can be related to a person who has introduced it. Now, the technology may die when the person shifts from his that posting to another post. But what we should try to create are something which people will ask. The motivation should be there with the people that I had this methodology or technology to touch base government service. Now it's not there, so I need it. Now that's a demand factor that has to come. That motivation has to be built in. That motivation can be built in only if the technology is scaled up faster. And for that, the capacity building and the skilling of our down, the lower level functionaries are very, very important. In this, all the administrators should become facilitators and trainers. I believe that the policymakers also should become, going forward, facilitators and trainers. Any policymaker, unless and until he trains himself, I would say that there will be a distinction. There will always be a gap between policy and implementation. When you train, your people down there or your team, you will find that there are many challenges, many issues. Now, then you again, in an agile mode, try to improvise based on the feedback, and then improve it and then again do it. Then you will get the best output. Now, what I seen in many technical interventions in government, in government, if you say 80% of the technology interventions are failures, only 20% are successful. I always to take the data of all the interventions. What I mean by success is that which stays over a period of time, and since its beginning, it has not failed. Whoever is the person who is at the head of the helm of the affairs, it continues because there's a motivation factor of the people, and it goes on and on. So such is only 20%. Now that's the reason is that most of those technologies, they are either in the waterfall or spiral model, created in that kind of a situation, but not on an agile mode. And agility will comes only when the persons who actually conceive or make the policies with regard to that also become facilitators and doers and implementers and trainers. If you ask me what are the two things that you will do to ensure that or you will focus on to ensure that how to bring in efficiency by use of technology and how it can be scalable, is that when we talk about India, the connectivity and network is still an issue. Though we say that lakhs of villages are connected, if you really go into a village, if there are say 500 households in that village, I would say that connectivity has reached only if all the 500 households are able to access using a phone or a small device that is in there. The penetration of smartphones are 95 to 96% in most of the societies that we are living in. And unless and until they are not connected, how can technology penetrate? Still, we have a way, long way to move in this regard. Last 15 years, I've been working on this. I've been seeing that, but still, we have, a lot of paths to travel to ensure that every household in India gets that connectivity. I also will suggest that we need a task force, at the national level and at the state level, just focusing on this. Now, whatever effort that is happening are all in watertight compartments. Certain organizations doing some partial work, not in its holistic manner. Now, this is the need of the hour. If you look at any country where technology interventions have gone to a level of reducing, the touch bases itself, they are all successful because every household there is connected. So we have still a long way to go. And the next challenge, or which we have to work on, is of course state capacity. Now, when I call state capacity, not everything is in our hand. State capacity includes, the includes the vision of the leader, the way the democratically elected people see technology as a tool to improve governance and the life of the people. So we may have to upgrade their capacity by, continuously orienting them. It also includes how the officialdom and the ground level workers are trained and brought into this understanding. Now that it's a very tough job. It's not easy to bring in that capacity. So even now we ask questions. If one state is successful with one particular technology intervention, the other state will say that we cannot do it because our state capacity is low. Now, why can't we do that? As far as technology is concerned, it's a neutral thing. Any technology, as far as human beings are working with it, it can be done anywhere. The only thing that will come as a hindrance is his vision to do it, and then the capacity building to implement it. And I think that we should focus on both this state capacity and the connectivity factors going forward. Any person who is interested in ensuring that technology can be used as a tool for easing or bringing a good life to people should focus on these two parameters. So I wish all the very best to all of you, all the technology masters and interventionists in this conference, and I wish them the very best. Thank you.